The top 10 deadliest illness. Coronary artery diseases (CAD). Stroke. Respiratory illness. Chronic obstructive lung illness (COPD). Cancers. Diabetes. Alzheimer's illness. Diarrhea. Tuberculosis (TB), cirrhosis. Summary: when people think of the deadliest diseases on the planet, their minds probably jump to the fast-acting, incurable ones that grab headings from time to time. In reality, many of these types of diseases don't rank in the leading 10 causes of worldwide deaths. An estimated 60 million individuals passed away worldwide in 2018, and over 70% of them was because of illness that progressed slowly. Maybe even more unexpected is that several of the most dangerous diseases are partially preventable. Non-preventable factors consist of where an individual lives, access to preventive care, and quality of health care. These all aspect into threat. But there are still steps everyone can require to lower their risk. Here are the top 10 illness causing the most deaths worldwide, according to the World Health Company (WHO). 1. Ischemic heart disease (OR) Coronary artery illness (OR) Coronary artery diseases (CAD). The most dangerous illness worldwide is coronary artery illness (CAD). Also called ischemic heart disease, CAD takes place when the blood vessels that provide blood to the heart become too narrow. Unattended CAD can result in chest discomfort, heart failure, and arrhythmias. Effect of CAD across the world. It's still the leading cause of death. Death rates have decreased in numerous European nations and in the United States. This is due to much better public health education, access to better health care, and other forms of avoidance. Nevertheless, in lots of developing countries, mortality rates of CAD are on the rise. An increasing lifespan, socioeconomic changes and lifestyle risk elements contribute to this rising trends. Risk factors and avoidance. The major threat factors for CAD include high blood pressure, high cholesterol, smoking of cigarettes, family history of CAD, diabetes, and being overweight. Speak with your medical professional if you have several of these danger factors. You can prevent CAD with medications and by keeping great heart health. Some actions you can take to decrease your danger include working out regularly, maintaining a healthy weight, consuming a well-balanced diet plan that's low in salt and high in vegetables and fruits, preventing smoking, consuming just in moderation. 2. Stroke. A stroke takes place when an artery in your brain is blocked or leaks. This causes the oxygen-deprived brain cells to start dying within minutes. During a stroke, you feel sudden pins and needles and confusion or have trouble walking and seeing. If left untreated, a stroke can cause long-term impairment. Strokes are the leading cause of long-lasting disabilities. People WHO receive treatment within 3 hours of having a stroke are less likely to have impairments. The Centers for Illness Control and Prevention (CDC) reports that 93% of individuals understood unexpected pins and needles on one side was a stroke sign. But just 38% knew all the signs that would trigger them to seek emergency situation care. Threat factors and avoidance. Risk aspects for stroke consist of hypertension, family history of stroke, cigarette smoking, specifically when combined with contraceptive pills, being black or being female. Some threat aspects of strokes can be decreased with preventative care, medications and lifestyle changes. In general, good health routines can reduce your danger. Stroke prevention techniques may include controlling hypertension with medications or surgical treatment. You must likewise maintain a healthy lifestyle, with regular workout and a healthy diet plan that is low in sodium. Avoid smoking, and drink in moderation, as these activities increase your threat of stroke. 3. Lower respiratory infections. A lower respiratory infection is an infection in your respiratory tracts and lungs. It can be due to influenza or the flu, pneumonia, bronchitis and tuberculosis. Infections normally cause lower respiratory diseases. They can also be caused by bacteria. Coughing is the primary sign of a lower respiratory infection. You may also feel shortness of breath, wheezing, and a tight sensation in your chest. Neglected lower respiratory infections can cause breathing failure and death. Impact of lower breathing infections around the world. Risk aspects and prevention. Danger elements for lower respiratory infection consist of the influenza, bad air quality or regular exposure to lung irritants, smoking, a weak body immune system, crowded child care settings, which mainly impacts babies, asthma, HIV. Among the very best preventative procedures you can take for lower respiratory infections is to get the flu shot every year. Individuals at high threat of pneumonia can also get a vaccine. Wash your hands regularly with soap and water to avoid transmitted germs, specifically before touching your face and before eating anything. Remain at the house and rest till you feel much better if you have a respiratory infection, as rest enhances recovery. 4. Persistent obstructive pulmonary disease or chronic obstructive lung illness (COPD). COPD is a long-lasting, progressive lung illness that makes breathing tough. Persistent bronchitis and emphysema are kinds of COPD. It was found that in 2004, about 64 million individuals around the globe were dealing with COPD. Impact of COPD all over the world. Danger elements and prevention. Danger elements for COPD consist of cigarette smoking or second-hand smoke, lung irritants like chemical fumes, family history, with the AATD gene being connected to COPD, history of breathing infections as a kid. There is no cure for COPD, but its progression can be slowed with medication. The best ways to prevent COPD are to stop smoking cigarettes and to prevent second-hand smoke and other lung irritants. If you experience any COPD symptoms, getting treatment as soon as possible boosts your outlook. 5. Trachea, bronchus, and lung cancers. Breathing cancers include cancers of the trachea, throat, bronchus, and lungs. The primary causes are smoking cigarettes, second-hand smoke, and ecological toxins. However, family pollutions such as fuels and mold also contribute. Effect of respiratory cancers all over the world. A study in 2015 reports that respiratory cancer accounts for about 4 million deaths yearly. In developing countries, scientists forecast an 80 to 100% boost in respiratory cancers due to contamination and smoking. Numerous Asian countries, especially India, still use coal for cooking. Strong fuel emissions represent 17% of lung cancer deaths in men and 22% in females. Danger aspects and avoidance. Trachea, bronchus, and lung cancers can impact anyone, however they are more than likely to affect those who have a history of cigarette smoking or tobacco use. Other danger factors for these cancers include family history and direct exposure to ecological aspects, such as diesel and other fumes. Aside from avoiding fumes and tobacco products, it isn't known if there is anything else that can be done to prevent lung cancers. Early detection can improve your outlook and decrease the signs of breathing cancer. 6. Diabetes mellitus. Diabetes is a group of illness that impact insulin production and usage in the body. In type 1 diabetes, the pancreas can't produce insulin. The cause is still not understood. In type 2 diabetes, the pancreas does not produce enough insulin, or insulin can't be utilized effectively. Type 2 diabetes can be caused by a number of conditions, including bad diet plan, absence of exercise or workout, and being overweight. Effect of diabetes all over the world. Individuals in low to middle income countries are more likely to pass away of complications from diabetes. Danger aspects and avoidance. Risk factors for diabetes include excess body weight, hypertension, older age, not exercising frequently, an unhealthy diet plan. While diabetes isn't constantly avoidable, you can control the severity of signs by exercising routinely and keeping great nutrition. Adding more fiber to your diet plan can assist with managing your blood sugar. 7. Alzheimer's illness and other dementias. When you consider Alzheimer's illness or dementia, you might consider a loss of memory. However, you might not think of a loss of life. Alzheimer's disease is a progressive illness that ruins memory and interrupts normal mental functions. These include believing, reasoning, and common habits. Alzheimer's disease is the most common type of dementia. About 60 to 80% of dementia cases are in truth Alzheimer's disease. The illness starts by causing mild memory problems, difficulty recalling information, and insinuates recollection. With time, nevertheless, the disease advances and you might not have memory of big amount of times. A 2014 study found that the number of deaths in the United States due to Alzheimer's might be higher than reported. Risk elements and avoidance. Threat aspects for Alzheimer's illness consist of being older than 65, a family history of the illness, acquiring genes for the illness from your parents, existing moderate cognitive problems, Down syndrome, unhealthy way of life, being female, previous head trauma, being turned off from a neighborhood or having poor engagement with other individuals for extended time periods. There is currently no known way to prevent Alzheimer's illness. Research studies aren't clear why some individuals develop it and others don't. As they work to understand this, they are also working to find preventive methods. Something that might be handy in minimizing your risk of the disease is a heart-healthy diet plan. A diet that's high in vegetables and fruits, low in saturated fats from meat and dairy, and high in sources of excellent fats like nuts, olive oil, and lean fish may help you lower your threat of more than just cardiovascular disease. They may also safeguard your brain from Alzheimer's disease, too. 8. Dehydration due to diarrhea illness. Diarrhea is when you pass 3 or more loose stools in a day. If your diarrhea lasts more than a couple of days, your body loses excessive water and salt. This causes dehydration, which can lead to death. Diarrhea is typically triggered by a digestive virus or bacteria transmitted through infected water or food. It's particularly prevalent in developing nations with poor hygienic conditions. Effect of diarrheal illness worldwide. Diarrheal disease is the second leading cause of death in kids younger than 5 years. About 760,000 children die from diarrheal illness each year. Threat factors and prevention. Danger aspects for diarrheal diseases consist of living in an area with bad hygienic conditions, no access to tidy water age, with children being the most likely to experience severe signs of diarrheal illness, malnourishment, a weakened immune system. According to UNICEF, the very best method of avoidance is practicing great hygiene. Great hand-washing methods can lower the incidence of diarrheal illness by 40%. Enhanced sanitization and water quality as well as access to early medical intervention can also help avoid diarrheal diseases. 9. Tuberculosis TB. TB is a lung condition triggered by bacteria called Mycobacterium tuberculosis. It's a treatable airborne bacterium, although some strains are resistant to traditional treatments. TB is one of the leading causes of death in individuals who have HIV. About 35% of HIV-related deaths are due to TB. Effect of TB around the globe. The cases of TB have fallen 1.5% each year. The objective is to end TB by 2030. Threat elements and prevention. Risk factors for tuberculosis consist of diabetes, HIV infection, a lower body weight, proximity to others with TB, routine use of specific medications like corticosteroids or drugs that suppress the body immune system. The best avoidance of TB is to get the Bacillus calmette gaira (BCG) vaccine. This is frequently offered to children. If you believe you have actually been exposed to TB bacteria, you can begin taking a treatment medication called chemoprophylaxis to minimize the likelihood of developing the condition. 10. Cirrhosis. Cirrhosis is the result of persistent or long-lasting scarring and damage to the liver. The damage may be the outcome of a kidney illness, or it can be brought on by conditions like liver disease and chronic alcohol addiction. A healthy liver filters hazardous substances from your blood and sends out healthy blood into your body. As compounds harm the liver, scar tissue forms. As more scar tissue types, the liver has to work harder to work appropriately. Eventually, the liver might quit working. Risk elements and prevention. Danger elements for cirrhosis include persistent alcohol usage, fat accumulation around the liver, non-alcoholic fatty liver disease. Chronic viral hepatitis. Stay away from the habits that can cause liver damage to help avoid cirrhosis. Long-lasting alcohol usage and abuse is one of the leading causes of cirrhosis, so preventing alcohol can assist you avoid damage. Likewise, you can avoid non-alcoholic fatty liver illness by eating a diet plan that's healthy, rich in vegetables and fruits, and low in sugar and fat. Last but not least, you can minimize the possibility of contracting viral hepatitis by using prevention during sex and by avoiding sharing anything that could have traces of blood. This consists of needles, razors, toothbrushes, and more. Conclusions. While deaths from some illness have actually increased, those from more major conditions have actually also decreased. Some elements, such as an increasing lifespan, naturally increase the occurrence of illness such as CAD, stroke, and heart disease. However, many of the diseases on this list are avoidable and treatable. As medication continues to advance and prevention education grows, we might see a decrease in death rates from these illnesses. An excellent approach to decreasing your danger of any of these conditions is to live a healthy lifestyle with good nutrition and exercise. Avoiding cigarette smoking and drinking in small amounts can also assist. For bacterial or viral infections, appropriate hand washing can assist avoid or minimize your threat. Here is the end of this video. We hope you have learned something new from this video. Thanks for watching. Please like, share and subscribe. Goodbye.